Conference audio only, adjust.
Hello everyone, and welcome to today's webinar, Switching Areas of Practice. My name is Amanda, and I'm part of the marketing team here at AOTA, and I'm going to explain a little bit about how these webinars will work. Each webinar presentation will conclude with the Q&A portion. You may begin typing your questions in for our presenters at any time during the webinar, but please note that we will only be addressing these questions at the end of the presentation, and we will do our best to address as many questions as time allows. Also want to make a note that if you are on the phone, if you could mute yourself, because we will be able to hear you on the call, and we'd much rather listen to our speakers. Anyway, and with that, let me introduce today's presenters, Nathan Sharp and Scott Trudeau. Scott?
Thank you so much, Amanda, and thank you to all the members who are on the line. And it's really great to be a member of AOTA with you all. I'm going to talk a little bit today about career transitions, but I'm going to talk about it from sort of a personal perspective. I actually started here at AOTA in February, which is probably why Amanda asked me if I would like to talk about career transitions, because I'm in the midst of one right now. I took a position here as Productive Aging and Interprofessional Collaborative Practice Program Manager, which is a new position for AOTA. So it's been kind of an exciting time for me in terms of my career and a little bit of an upheaval. I moved from the Boston area down here to Maryland to take the position, and actually just this week my wife has started a new job down here, and she has been able to join me. So the concept of transition is sort of very real in my life at the moment, so hopefully I can offer some interesting insights for you. Basically what I'm hoping to do in the next few minutes or so that I'm talking with you is to set the stage a little bit about some of the things that are going on in the employment world and culture, sort of big picture view, and then review a little bit on my own career experience, and then offer some ideas for folks who are considering a transition. So what's been going on? I had the realization, my three daughters actually all recently graduated with bachelor's degrees and have been looking at careers, and I was a little bit appalled when one of my daughters decided that the best place to look for a position was Craigslist. And she actually found a position and accepted the position and is very happy in the position, but she got it off of Craigslist. So I began to feel kind of old, but also to realize that there's really a shift in terms of what's happening in terms of employment that probably is important for folks, especially folks who have been in a career or in a position for a while and maybe thinking about transitioning to recognize. So I did a little bit of background search. I'm not by any means an expert in this area, but I did a little bit of background search and was kind of surprised to see that there are many articles and many sources of information that suggest that folks should think about shifting or changing careers or making job changes at the very least about every 3 or 4 years. And having been in my last position for over 18 years, well, I was actually at my last employer for 18 years in a variety of positions, but that 3 to 4 year shift was a little bit interesting to me. And some of the advantages, though, that they talked about in terms of making that shift were kind of interesting to me, and that the idea that sort of new challenges are really mobilizing to you as an employee, that they give you the opportunity to really look at being adaptable to the demands of the new situation, to learning sort of in a fast pace, a fairly steep learning curve. So if you're going to be in a position for 3 or 4 years, you want to learn very quickly how you can make an impact, make the impact, and then move on. the one thing that was interesting about this particular article that I was looking at, and this actually is a little bit, can we just ask that folks, if you're on the phone line, if you would please mute your phone. There's a fair bit of feedback coming in that may be distracting to folks. Thanks so much. We appreciate it. So the idea that shifting jobs quickly really kind of keeps people on their toes and keeps the learning current is an interesting concept to me. The one exception I started to say, again, someone is still has their phone line open.
Actually, Scott.
Yeah.
Scott, can you pause for a second? We're gonna mute everybody and then unmute. So if you can just pause for 1 quick second.
Sure.
And I'll let you know when to come back on.
Still marking you out to everybody. He's only going to be here for like 3 or 4.
Okay, Scott, you can continue.
Shall we forge ahead anyway?
Well, yeah, we're going to have to. Thanks.
Okay. So the one area that the shifting jobs every 3 to 4 years is not recommended is actually the area that Nathan's going to talk a little bit more about, and that's in the area of academia, that it actually pays to stay put. There is some mixed information out there. There was recently a study that was completed by the Wharton School that actually suggests that when they look at it on a little bit more granular level, they believe that it's actually advantageous from a financial perspective, at least, to work your way up a career ladder within an organization, as opposed to shifting to a new organization every time. So that's something to keep in mind as well. So as you're thinking about a job search, the idea of that particular article and study suggests that you want to really think about what's the mobility within this organization, and really have an opportunity to move up. That in the long run, they felt that was financially advantageous. It's helpful, I think, for me. I always like to think about the idea about why are people drawn to occupational therapy? You know, this idea of what brought you to this point. And certainly, I have a background and have taught for the last 20 or so years, and have had experiences where there was, 20 years ago, I would suggest there was a fair amount of a fairly high presence of second career people. So that right within our own occupational therapy curriculum, and we were addressing sort of people in transition, which was always very interesting and exciting. I think as the recession has hit, it's much more likely that folks are moving, through an educational or academic pursuit, sort of more in one sitting, where people are taking less time off between their baccalaureate and graduate degrees, as a method for really establishing themselves in a career. But when you think about and do an inventory for yourself about what brought you to this point, how did you get to be part of the field of occupational therapy, within that, there's really an opportunity, I think, for you to see your core values and your core beliefs, and that becomes really important, as we'll talk a little bit more. So I've been an occupational therapist for over 30 years. I won't give you the exact number. And over the course of that 30 or so years, sometimes people will ask what's the best thing about a career in occupational therapy. And I have a pretty confident answer to that. And the answer for me is that practice areas are plentiful. That the opportunity to be an occupational therapist, that means a lot of different things to each of us. And it really means the opportunity is rich for us to shift and evolve in our own interests and experiences as we move through a single career in occupational therapy. But it can be a very diverse experience. It is not just one thing to everyone who's an occupational therapist. So let's look at, oops, I hit the wrong button. Let's look at some of the different things and different areas that I personally have had the privilege of experiencing in my career as an occupational therapist. I've worked in inpatient hospital settings, I've worked in home care, I've worked in outpatient clinics, I've worked in hospital administration, I've had the opportunity to teach, I've had the opportunity to do research, to really sort of expand my own skill set and to keep myself current and myself interested, but also hopefully to make a significant contribution in that process to our chosen profession. And it's pretty clear to me after doing this for 30 years that, I've never in my career felt stuck. I've always felt like I've had options. And for me, that's been a really huge advantage to a career in occupational therapy. So why would anyone even think about wanting a transition?
The host has left the meeting to speak with meeting support and will rejoin soon.
Does that mean
you can continue.
I can
Nope,
continue? Okay.
Keep going.
Sorry.
Keep going. Sorry about that.
For me, that has meant family needs, trying to, I talked a little bit earlier about, having kids, having a wife, making decisions within the context of that, often driven by money, flexibility, benefits. You may have noticed on my title slide that I have a PhD. I didn't start out with a PhD. I've accumulated. I actually started out in occupational therapy with a bachelor's degree, later got an advanced professional master's degree, and then my PhD. And then certainly the idea of, thinking about it's time to reinvent myself at a point when I'm feeling like I've maxed out. I'm sort of stagnant in doing what I've been able, what I'm currently doing. One of the articles that I pulled in preparation for today actually identified the 4 top reasons for job changes, and this is generally not just for occupational therapy, of course. But the first one was opportunities for career progression and advancement. So promotions are sort of the top reason for changing jobs. The second reason, I think, is a little bit more troubling, which is basically a toxic work environment, that the work that someone is doing or the system that one is doing it in is really really troubled and really causing more stress and angst than one can tolerate. Then there's external factors, downsizing, right-sizing, changes in reimbursement that are sort of shifting the focus. and maybe, causing layoffs or other external forces that are requiring a job change. And then the last one, which I think is related to the others, is that the individual is actually seeking a better work environment. So it's rather complicated, and I think it's rather personal when one thinks about wanting to make a change. How do you go about it? How does one even approach the opportunities that exist to see, is this something that I want or can successfully transition into? And these slides all sort of reflect, or these pictures on the slide all sort of reflect the same idea. The idea is that you really just have to start. When I started pursuing my PhD, I actually developed a mantra, which was, I can't finish if I don't start. I can't finish if I don't start. So that's really the same holds true, I think, for any major career transition. It won't happen unless you get started. But what are some of the things that you need to do in order to get started, and what are some of the opportunities that might exist? The first, and I called it do your homework. Some of the articles that I read, actually there was one in particular that I thought was useful. It was a career coach had posted an article on LinkedIn talking about what she recommends, the 5 steps. It's great if you can distill everything down into 4 or 5 steps. But I thought hers actually had some merit. The first step for her was to reflect on where you've been, reflect on what you've been doing, reflect on how you got there, reflect on, as I said earlier, why did you want to be an OT when you grew up. So sort of do a self-assessment and think about what your core values and needs are. And then do some research and try to understand what opportunities might match with those core values. Especially if you're in a situation where you are dissatisfied with your current situation, it would be important to look at what opportunities might there be that would be better aligned with your core values and goals. The next step, which I think is kind of interesting, so these are all our words. She says rebrand. So update your resume to reflect what you want to be doing, not what you currently have been doing necessarily. And that becomes really, I think, something that I think sometimes we think, I do this myself, I think that my experience is my experience and it should stand for itself. But really understanding that there may be ways for me to describe those experiences or to shape
It's not about being sharp, it's about a million pieces.
To shape the information that I'm sharing with people based on what it is I'm trying to accomplish. So again, I think this is really relevant for us as OTs because, the clinical skills that are involved with assessing children are core skills that we would bring to assessing any population. So if I have a lot of experience doing standardized assessments, I may need to learn new standardized assessments in a different population, but that core skill is something that I'm already bringing to that position. And so it becomes really important for us to sort of make sure that that's reflected in the materials we put out about ourselves. The fourth step that she suggests is repositioning. And I think that for me was a really interesting step to begin to think about who are you accessing in your network? She suggests that the majority of positions are never even advertised, so that it's really who you know and getting the word out that you're interested in making a transition that's really going to go a long way to accomplishing that transition. So networking becomes really important. One of the other pieces that is important with networking as we think about today's situation are things like LinkedIn. Looking at what social media has to helping us to connect with people who are doing the kind of work that we want to do, and trying to understand and connect with them to get a better understanding of what we're getting into. Key to that can be the opportunity to identify a mentor, to identify someone who's established in a particular area of practice that you're interested in, or in a particular role that you're interested in, and really asking them to help guide you, to give you some insights. And then another area that you want to think about in terms of repositioning is the opportunity for informational interviews. It's really important, I think, to, we're all I think, this is my opinion, that occupational therapists at our core are caring people, and we want to help other people. And certainly most of us want to advance our professions. So I think the idea that, we would be interested and available to help mentor somebody who's interested in following an area of practice that I may be already working in, I think is not such a huge leap. And then her last R is re-enter, and it's re-entering the workforce. It's making sure that you do actually get the word out, you get your resume out, you identify places that might better meet your needs in the career trajectory that you're pursuing. I sort of spoke a little bit just off the top of my head on this screen, and I have a couple of additional thoughts that I would like to just share with you. Doing your homework, really making sure you kind of understand as much as you can about the nuances of what you're trying to do. So if you want to move from, again, a pediatric practice to a geriatric practice, what does that mean? How are those two settings different? What are your expectations about that? And trying to go out and do some investigation to make sure your expectations are accurate. I already mentioned networking and informational interviews. Sometimes volunteering. If there's an area of practice that you are interested in trying on, you're not sure if it's something that you're even really would be interested in pursuing, finding an opportunity to shadow or volunteer in a clinic is a huge opportunity. There are opportunities in terms of things that sort of existing programs where things like I'm thinking about CarFit. If you're interested in maybe pursuing a driver rehab specialty, certainly volunteering and getting involved with some event like CarFit could give you an opportunity to sort of test it out and feel it out to see if dealing with people and cars is actually something that you'd be interested in. And a lot of times through that, you also can be establishing networking opportunities with colleagues who may already be working in the area. The internet is a beautiful thing. It really gives you an opportunity to not only look at types of opportunities, but also to do some investigation about settings, to look at organizations that you might consider working in.
The worst, like, webinar.
you said.
The other thing,
But I have to take a certain number of live courses in this account.
the other thing, if you could mute your phone, that would be helpful, even though you have to take live courses. The other thing is to remain open to opportunities that, things don't just, fall into your lap kind of thing. The idea that, we have to position ourselves and be ready to sort of jump when the opportunity presents itself is really pretty critical, at least in my experience. So, for instance, I was not in the midst of a huge job search when the position that I'm currently in was advertised in OT practice, and I said, I think I need to try. I need to look into this. I need to understand it a little better, and I must admit I'm pretty happy with the transition. So had I not remained open, and it was, as I said, it was a huge, it almost was too daunting a task to think about packing up and moving and all the upheaval that involved. But remaining open really has led to something great, I think. So I would welcome folks to reach out and contact me if you have further questions or thoughts that you'd like to bounce around. Here's my email address, strudeau@aota.org. And with that, I will hand it over to Nathan.
Well, hello there, and Scott, thank you so much for sharing. That was very informative and very thought-provoking in terms of making a transition. So thanks for having me, and it's really an honor to present at AOTA Member Appreciation Week. So I am Nathan Short, as I said, and I currently teach at an OTD program at Huntington University in Fort Wayne, Indiana. And so kind of keeping on the theme of changing practice settings, I just took this position about 2 years ago. So I'm sort of in the midst of the transition in some ways still acclimating to kind of academia versus the clinical setting. And so that's what I'm going to touch on today, is transitioning from the clinical setting into an academic setting. Sometimes I think as clinicians, we start off in our OT careers and we think, kind of maybe not as broad in terms of opportunity. Maybe we want to specialize in an area of clinical practice. And so perhaps teaching or academia is not on our radar. And so today we'll talk about some pros and some cons perhaps of making that transition. So to start with today, we'll just outline a few objectives. I hope to inform anyone that is considering a transition into academia, just some considerations to keep in mind and some things to do perhaps in preparation to do that. We also want to look at some job trends in terms of opportunities out there, as well as the ACOT requirements to take a faculty appointment, and also talk about contract negotiations to meet your professional needs. I think that the contractual aspect of things is quite a bit different in the academic world versus the corporate or clinical environment, so we'll touch on that as well. And then also strategies to bring your specific skill set and clinical expertise into the classroom. So to give you a little bit about my background, I'm fairly young in my career. I graduated from Belmont University in 2009 with my OTD, and I worked with the Indian Health Service serving the Navajo population in Gallup, New Mexico for the first 5 years of my career, primarily in outpatient hand and upper extremity. I did get my CHT credential about 2 years ago, and so the work there was primarily in hand and upper extremity. I did a little bit of PRN and rehab and a little bit of home pediatrics, but primarily outpatient. So I got a call out of the blue in 2014 from a professor of mine, former professor, and she said, I'm starting this OTD program and I want you to come and consider teaching here. It was really out of the blue, not something that I had on my radar at all. My knee-jerk reaction was just to kind of shelve it and just say, no, I'm happy in my current area of practice. I feel competent in what I'm doing. I'm pretty settled here. But the more that we thought about it and considered things, my wife and I decided that we would give it a try. And I'm really thrilled that we took the opportunity. As Scott mentioned earlier, when you're thinking of transition, there's a thought process and there's preparation, but then there's just kind of taking the plunge and doing it. And so sometimes I think we hesitate out of fear or kind of a comfort level in our current area of practice. Maybe we don't want to get out of our comfort zone. And so I think the rewards are exponential when we do take those risks in a lot of cases. But now that I'm here at Huntington, I'm teaching basically my similar areas of practice. I teach orthopedics, neuroscience, kinesiology, and we also have a global outreach course where our students do some international service. So the picture there on the slide is the Seating and Mobility Clinic in Haiti. We partner with a group called Wheels for the World, and we've done that the past two years. This year we'll actually be doing the same, similar project in Guatemala. So this is a course that's embedded into our students' curriculum, and they get to do this international service as part of that course. The other consideration for me was because I was younger in my career, I didn't really feel ready to leave the clinic. And fortunately, was able to negotiate a clinical day in my contract. So every Monday, I still have time blocked to go and work in a clinic locally, and I maintain that clinical immersion and maintain my skill set as a hand therapist as well, which really lends itself to education because I can bring those cases and treatment techniques right into the classroom. It's oftentimes I'll have patients that really correlate with the content in any particular module or week, and really helps to highlight and make the content clinically relevant to our students. I've also, this past summer, was able to serve as a visiting professor in China. So I taught a modified version of my kinesiology course to Chinese therapy students, and that was a really unique opportunity as well. So these are just to me, some of the highlights of my transition into academics and some of the things that really stand out in the past 2 years. When you're considering academia, it is definitely a shift in your perspective and dynamics. And so when you're thinking why academia, well, the big thing for me is to really get to invest into the next generation of OTs, to see our students come into the program with such enthusiasm and creativity, and you kind of get a guide and shape that, and you see them kind of find their niche within the field is very rewarding. The other thing in an academic setting is that you have time dedicated to pursue research and scholarly activities. Research and scholarly activities is really not on my agenda as a clinician because you're already working 40 hours a week. You've got personal commitments outside of work. When do you have time to do any kind of research? But that's really built into your schedule and contract as a faculty member. And so if those are things that you have in mind that you would want to pursue, that is one big benefit. Also, the flexibility of schedule. You do get to move back into the kind of school and academic schedule, so you get the holiday breaks, at spring break and Christmas break. And I know that I'm at least, if not more, excited than the students when our breaks hit, because I get that time off and kind of break to refresh myself. You can also have a varying length of your contract, so you don't have to have a full 12-month contract. You can do a 10 or 11 month, sometimes even a 9-month, where you might have 3 months off at a stretch if you wanted to pursue something else or do a travel contract in the summer. You really have quite a bit of flexibility in terms of schedule. It's not really the 8 to 5 job that a lot of us are used to in the clinic. Sometimes it can be all-consuming and seem like it's 24 hours a day, but you do get some pretty generous breaks through the year as well. The other piece is that, as clinicians, we know that we leave kind of physically exhausted depending on what setting we're in. It's really kind of the opposite. I really feel like it's the mental aspect of things. It's the brain that's tired when I leave teaching every day. And so it does save your physical body, and you know, it's a nice transition from the clinic if that's a concern, if you're getting more towards retirement and have those kind of considerations. And really the personal and professional rewards are exponential. When you see your students have those aha moments and understand concepts, and they're able to apply them, and they're bringing in examples from their level 2 clinicals, it's really a wonderful feeling to be able to contribute to their growth and development as well. So if you have academia anywhere on your radar, but you've got some hesitations, the ones that really stick out to me when I was considering whether to pursue this were just the lack of teaching experience. You know, I'd been a clinician for 5.5, 6 years, and I hadn't really done any consistent public speaking or anything like that. But really, as OTs, we are educators, all of us to some degree. We're educating our patients on their adaptations and modifications of our ADLs. We're educating them on disease process. And so through the course of your clinical career, I think you'd be surprised to sit down and think about the areas of expertise that you have. I mean, we're really covering the spectrum of healthcare in our communications with our patients, and so you might be surprised at the expertise that you do have. Some of us also have a visceral hatred of public speaking. That was me to a certain extent. I pictured myself, you know, wearing a cardigan at some podium lecturing for 3 or 4 hours. But if you think back to your OT education, it's very hands-on and dynamic. A lot of our time is lab time, so you're demonstrating technique, and it's really not this traditional lecture all the time. I mean, there's some traditional lecture involved, but it's very much more, I think, engaging and hands-on than we think of traditional academics. And then the other consideration is perhaps you don't want to leave clinical practice. So as I mentioned, you can certainly work a clinic day into your contract, and I would tell anyone considering making that transition is to bring the clinic with you. Bring all your documentation templates and your clinical examples and anything you can, bring it into your teaching. Really, the students really engage when they hear your clinical stories. They want to hear this stuff applied. How's it going to impact them in their future career, and how will it impact their practice? And so the more clinical resources you can bring, the better. When you consider teaching, I think one misconception I had is that teaching would be kind of the predominant thing that I would do as a faculty member. And while it is a big portion of what I do, there's a lot of other things involved. You are, depending on what type of university you're at, whether it's a research-focused or teaching-focused school, there are research and kind of presentation and publication expectations. And so a lot of what you're doing out of the classroom is working on that kind of thing. We all advise student research projects. Here you can see some of my students who did some research on an app. So the nice thing is you have all these enthusiastic students and to work with and collaborate with, while you have the clinical expertise to guide their research. So it's a really nice collaborative process. They bring the energy and creativity, and we sort of bring the clinical expertise to collaborate. So a lot of what you're doing outside of the classroom will involve those kind of things. You're also serving on committees. I serve as our admissions committee chair, so I organize our preview days and interview days and our admissions process throughout the year. You're going to get plenty of opportunities for networking. Depending on what's in your contract, the university benefits when you go to conferences and present at conferences, and when you get specialty credentials, and so they really support that, at least here at Huntington, and it's a win-win. When you succeed professionally, the university gets some good press out of that, and everybody kind of benefits there. You also get, you know, if you're at a relatively young program, you're going to have a lot of say in their curricular and program development. So to guide the way a program comes together, to me, is very rewarding too, and also plenty of opportunities for community involvement. We have partnerships with some pretty big national organizations. One of our faculty partners with Ambux, and our students do some fundraising and projects with them. I mentioned we have the partnership with a group called Wheels for the World. So we do the seating and mobility clinics in the developing world. We've got another faculty that's certified in CarFit, which I believe Scott mentioned. And so she does CarFit events throughout the year. So there are plenty of opportunities to continue your volunteerism and your service through your profession. And as I mentioned before, you've got this army of enthusiastic students behind you that will usually get on board and run with it with you. So just to give you an idea of the current job market, these stats are a little bit dated, but as of 2014 and 15, there were over 100 full-time faculty positions available. That's taking into consideration master's and doctoral programs. You can see a lot of job postings in any OT practice or advanced OT publication for specific schools. So really the demand is there. We are an OTD program, and there are currently 11, I believe, but there are a lot in the queue to be accredited. So there'll be many more opportunities to teach at the doctoral level, still at the master's level. So the opportunities are really there if it's something that you're interested in. The other thing you might be wondering is, what are the ACOT requirements? I think because I went to Belmont and we had a really seasoned, experienced faculty, I just assumed that you had to have 5-10 years experience before you were qualified to take an academic position. But the ACOT requirements, you can see here on the slide, the language just says documented expertise in the area of teaching responsibility. So there's no set number of years that you have to practice. You just have to demonstrate expertise in your area. So if you've already got a specialty credential, that's enough. You can always do further continuing ed to bolster your skill set in a particular area. You do have to have a degree that's equal to the program, equal to or greater than the program that you're teaching in. So for instance, the doctoral program, all of our faculty have OTD credentials here. A PhD like Scott would certainly be eligible to teach at this level. The master's, all of your full-time faculty have to have a master's degree, and then for OTA programs you have to have a bachelor's degree. And so basically you have to have the degree or greater than the program you're teaching in. That's for full-time. However, there are other ways that you can teach part-time or adjunct without having those terminal degrees for the program, and I'll touch on that momentarily. Then the other component, which we're all used to, is just having a current valid license in the state which your program is located. Those are ACOT requirements, so that's what our accreditation body says. You may have other requirements based on the individual institution, so they may have an outline or a requirement that you have a certain amount of practice or experience, but ACOT does not. So if you're interested in academics, how do you get experience maybe without taking the full plunge or making a concrete commitment? So there are quite a few opportunities to do guest lecturing. We pay people to come in and guest lecture by the hour, so it's just an hourly thing that we bring local clinicians into. If you've got specialty expertise in lymphedema or custom orthotics or what have you, you can certainly come in and simply guest lecture and go home for the day. You can also serve as an adjunct, and that would be a little bit more of a commitment where you might teach a single course or a full module within a course. So in that aspect, there's a little bit more commitment involved in that you might be grading some of the assignments, or you might be committed for an entire course, so a little bit higher level of commitment. You can also serve, as we all know, as a clinical instructor for a level 2 student. I think that in and of itself is a great experience for somebody considering academics because you're kind of hearing from the student what the trends are in education, and you're learning to break down and communicate what you're doing to a OTD student or a newer person in the field that doesn't have the clinical exposure that you do. You're learning to break down those concepts for the student level, and I think that translates really well into the classroom as well. You can also serve as a lab assistant. So we have some local clinicians as well that will come in for specialty lab areas. So if you're in an area where there is a local university, these are opportunities for you to kind of get your feet wet and explore a little bit before making a full commitment. If you're not in an area where there's a university with an OTE program or an OT program, you can always do some Skype sessions. We frequently have different clinicians in specialty areas Skype into our courses as well. So with the technology that we have at our disposal, there are ways to implement that externally or outside of the area of university as well. In terms of your contract negotiation, at least for me, I found the university setting to be much more flexible than a corporate or clinical environment. You can really be quite creative. Our faculty here at Huntington, we all have different sort of schedules written into our contract, different clinical days that really meet our professional needs. We have one faculty member that will be going to part-time and still working for a corporate entity as a manager. And so there are ways to really, kind of stay in your current area of practice and also teach if that's something of interest. But you want to think about things like the clinic day, vacation time. We typically get all the university breaks, but then you're also going to want some vacation time throughout the year as well. So how does that play in? What is your continuing education budget? These are things that you want to think about and really get in writing. If there's anything I could push, and obviously this is true clinically as well, but I think things in academia can shift. Faculty can leave, content needs can change, and so the things that you are really passionate about, the deal breaker, so to speak, that's something you're going to get that you're going to want to have written in your contract. The other thing, Scott also alluded to the benefit of staying long-term at an academic posting. And so you do have different tenure and non-tenure tracks. So tenure, obviously, there are some research and publication and scholarly activity requirements that will allow you to be eligible and apply for tenure at a particular school. Then you also have non-tenure tracks that perhaps do not have the kind of ancillary requirements that the tenure track would. So there certainly are pros and cons to each. The tenure, you have a bit of stability in terms of job security. If there were any kind of shakeups or issues at the particular university you're serving with. And then non-tenure, you really don't have maybe as many scholarly requirements as you would with the tenure track. The other thing to think about, and this really was, I think, the kicker for me to go ahead and make the transition, is the fact that, as Scott mentioned earlier, we have such mobility within our profession. You get maybe a little bit burned out in one setting, you can easily transition to another. And so my end thinking when I committed to come was, you know what, if I stink at teaching and I just can't stand it, I can always get a clinical job in Fort Wayne. And so I think that's, pretty much true anywhere you go. So really, the transitions within a profession like OT, the risk in my mind is pretty minimal because there's such opportunity everywhere. And so you kind of have that safety net to lean back on if you need to. Well, I really appreciate everyone's time. I did tell Amanda that I was going to put a shameless plug in at the end. We have had a faculty position open here at Huntington. So if anyone is interested in making the transition soon, feel free to contact me at my email here if you're interested to hear more. So thank you for your time and attention, and I believe at this time we will open the floor to questions.
So this is Scott. I think I'll take the first question. Actually, I deleted the first question that I want to take so I don't forget that it was posted. Someone posted a question about transitioning from a long-term psychiatric position to more of a physical rehab setting. And one of the things that I didn't mention or address in my talk that I wanted to, I had a note to, was the role that continuing education plays in developing your skill set and making sure. So certainly within AOTA. We have badges that people can earn through continuing ed activities. There's certainly lots of other commercial vendors that will allow you. So if you're, thinking about a physical rehab setting and there's particular skills that you want to show that you would be competent in, that certainly continuing ed would be an opportunity to sort of bolster that part of your resume. And I think all the other things that I talked about in terms of networking and sort of doing your homework will also work for that kind of a transition. So I will leave that question, and Nathan, do you want to take one of your questions?
Sure thing. I see a question down here about a compensation package. And I think I just lost it here. Anyway, the question was, how did the compensation package in academia compare to direct patient care? And speaking for myself, only and bear in mind, I'm at a smaller private university, it was very comparable, if not a little bit better than what I was making clinically full-time. And also, the clinic day, you're making money on your clinic day, and that's sort of extra side compensation as well. So the whole package for me was probably better than what I was doing in just direct patient care.
Good. I have a question. Any suggestions about leaving the profession for a few years to stay home with young children and then re-entering the workforce? I don't have that personal experience, but certainly know lots and lots and lots of people who have been in that position and have successfully transitioned from being a stay-at-home parent to being back in the workforce. I do think that, from my perspective, one of the things that, again, I said this earlier, that OTs are caring people. So we get it. We get that, your values and your priorities may shift over time. And I don't think we're scared off by that as some other professions might be. And then the other piece, again, just to go back to some of the other things that we talked about in terms of networking and, putting yourself out there and making sure that people know, your fellow OT students when you were in school may be clinicians now, and making sure that those folks know that you're back on the market and you're looking for a position, and they may have some suggestions on how to ease back in. So certainly reaching out is going to be key, I think.
Here's another question from Susan Schwartz. How do you customize your presentations to the needs, interests, and preferences of your students? And are there any trends that you notice in the classroom with information absorption and attention spans? Yeah, that's definitely a big issue there. I think with this generation, certainly that has grown up with such integration of technology, we do try to integrate app technology when we can. I've got an anatomy app that I use to teach our kinesiology course. And so when I can, I integrate those kind of things because I think they're going to see that clinically as well with their future patients. But it is difficult to maintain attention span for like a longer lecture. So what I've learned, maybe the hard way, is just to break things up. I lecture, and then you can kind of tell you're kind of losing them a bit, and so you transition to maybe a pair and share activity where there's a little more interaction among students, and then on into like a lab activity or something like that. So you want the students to learn to be able to focus and absorb information in a traditional sense, but then also, keep it kind of fresh in terms of switching things up when you can.
I have a question, I guess, also from Susan Schwartz. I think that was who the last question was from. What trends in healthcare or social services are creating non-traditional roles for OT, considering career transitions? And I think, this area is really kind of opening up a bit. There's been, certainly in my world of working with older adults, the link between the community and healthcare through some of the changes in CMS reimbursement patterns and so forth and so on with the Affordable Care Act and with MACRA really are setting the stage, I think, for OTs to step up and be in some really pretty trend-setting and innovative market niches. So looking at developing community partnerships, if you are at a healthcare facility, understanding who out in the community is providing services to the folks that you're serving can really be an opportunity to set yourself up to develop a program, to step up and reach out to meet a need. One of the key situations is this idea that primary health care is going to be not just a doctor's visit in a doctor's office, but really how is the individual's whole care, both in the health care specifically, but also in the community, being managed. And I think OTs have a major contribution to make in that area.
So I'm seeing quite a few questions come over about the need, what degree do you need, and then also some of the research components involved. So as I mentioned earlier, if you're going to take a full-time faculty appointment in an OTD program, you would have to have an OTD or PhD. With the master's, you would need your master's, OTD, or PhD. So the level of your program or higher, that's for full-time appointment. Let's say you're working towards your OTD or PhD, you could theoretically come on as part-time or adjunct and teach while you're working on the degree, and then come on full-time as you complete your terminal degree. In terms of research, someone asked how important is the research component of your degree if you're going into academics. It really depends on the type of university you're at. You know, if you're at a Research One, like a big state Research One school, that's going to be a much bigger priority for the university than, say, a teaching school. Here at Huntington, we're more of a teaching school, so the emphasis is on quality of teaching and instruction. But we do have research requirements for our tenure track positions as well, and all the faculty in the program are on the tenure track. So we do a certain amount of research, but the beauty is, you know, we really collaborate and work together. That was one area I felt that I really needed to brush up on were my research and critical inquiry kind of skill sets. But it's been a really nice process, kind of, you know, bouncing ideas off one another and kind of learning as we go as well.
And just to draw a correlation here, that piece that Nathan just described in terms of sort of understanding the setting that you're going in and what the priorities going into and what the priorities of that particular institution, you know, there's a breadth of facilities that we can work in, and doing your homework and understanding, you know, I might not fit in real well with a Research One university, but a smaller program I could offer a lot of skills to. So being clear up front about that as much as you can. We have a participant who will be 55 when she completes her master's in OT and wonders about how long she should settle into her first job before considering switching. You know, I really think that there really is no right answer to that. I really do think that it is, in fact, a personal decision. I think it has very much to do with what kind of growth is available in the setting and what's happening for you in terms of your level of satisfaction. So I really don't think there's a magic number that I would put on it. But best of luck in the transition.
All right, everyone. Well, that's about all the time we have for today. I'd like to thank Nate and Scott for presenting today. Thank all of you for attending. And, of course, thank you for being AOT members. Have a great day, everyone.
Thank you.
Thanks, guys.